Mm, 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 mm. Mm, 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 mm. Mm, 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 mm. Do-do-do, do-do, do-do-do-do. Crap, am I doing this right?
This was in the second half.
Okay, I think I can hear things now.
Can you hear me?
Yes, ma'am.
Okay. Let's see. Just pull up it. Okay.
But like a man.
What the?
So also going to be on here is skin cancer. So you should know the different presentations for the different skin tumors: basal cell carcinoma versus squamous cell versus malignant melanoma. It's very specific presentation when you observe that lesion. And then also the treatment. Is it burned? Do we excise the lesion? Do they need chemotherapy, et cetera, et cetera? Along those lines are patient teaching to prevent skin cancer. So how do we prevent or reduce the risk of developing skin cancer? For surgical patients, when they have surgery and they have an open wound or with sutures or with stitches or staples, it's expected that it's tender around the site, right? I mean, we just open them up. So tenderness wouldn't necessarily be a sign of infection. So what would a nurse observe that may indicate that that surgical wound is now infected besides tenderness?
If it's warm.
Yeah, right? Warm. Is it swollen? Is there a specific type of drainage or discharge coming out of it? Is it red? things like that.
Miss Sally, when we're
Yeah.
taking the exam, is it gonna specifically ask like, oh, this person has a blister like I don't know across their chest? What kind of disease or disorder is this? Or is it gonna
Yes.
be like a picture and then you identify the picture?
It'll be a description in words.
Okay.
Yeah. Let's see. What conditions or chronic conditions affect wound healing process? So we talked about in the surgical section about different diseases or conditions that can delay wound healing and what the nurse, has to plan ahead for or maybe compensate with their diet. So like malnutrition or diabetes, things like that. You should know the the presentation of the different type of lesions, like herpes simplex versus herpes zoster, the pityriasis rosacea, impetigo, eczema, psoriasis, and lupus. Okay. When we're assessing the skin, if somebody says, oh, you know what, I just noticed this dark, I don't know, circle on my upper back. What are the questions that we ask about the lesion? What are some questions? I believe I had a slide on there. It was like 2 boxes. One for, let me find it. Oh yeah, it's under the slide for assessment. It was 2 boxes. You should know those questions. The first one was the PQRST. So if somebody says, oh, I have this lesion, or if you find a lesion on a patient's body during your assessment, those are the questions that you should ask. And then the second assessment acronym is ABCDE. ABCDE are questions that we ask for skin cancer. Okay. You may see a few questions on psoriasis. So, what is the clinical presentation of psoriasis? What is the expected treatment? What are patient teaching and nursing interventions for psoriasis? How is herpes simplex 1 versus different than herpes simplex type 2? Burns. For burns, there are different staging, different severity, just like pressure injuries or pressure ulcers. So you should know the staging for pressure ulcers and the staging for burns. And then for surgical, what are some nursing interventions if the patient expresses fear or anxiety of the procedure? What is an allergy that is super important, probably the most important to know when preparing a patient for surgery? Can anybody tell me?
What? Oh, latex.
Latex, correct.
Yeah,
Yep. You should be familiar with the post-op exercises, like the breathing, the cough and deep breath, the splinting technique, using the incentive spirometer, how to properly put on the compression stockings, and the sequential compression devices. If a patient asks you a question about the different anesthesias, like, oh, what kind, am I going to be put to sleep, I don't know, for this mole removal on my arm? You should be able to identify what anesthesia is appropriate for the procedure and just give the patient a little bit of information about it. Like, oh no, you're not going to be fully sedated, or, oh, you will, and you're going to put a tube down your throat, things like that. For post-op period, some nursing interventions for the post-op that you may do, like, for example, if the patient is cold, what do we do? What is that time period that's most critical post-op? Can anybody tell me?
When the patient can get hyperthermia because the
arm is cold.
First hour.
Yep. It's that first hour that the changes can happen. That's the most critical period. It's the first hour. And then normal post-op period findings, like, is it normal for the patient not to be able to urinate within the first hour or so? How soon do we want the patient up and walking? Is it normal to feel distended and bloated? Things like that. Let's see. And then again, of course, informed consent. You'll probably see another question on that again, since it relates to surgical procedures. And that's about it. Any questions on this topic?
Can you show us a picture between the different skin cancers? Like, how would you tell the difference?
Yeah, I'll post something on the announcement. I think your book has a few pictures on them. It's like basal cells, like shiny, melanomas, like a really dark black, things like that. There won't be tricky. It's very, they're all very different like that. Yeah.
Okay.
Yeah. Any other questions for MedSurg before I move on to the farm? And if you think of a question, you can always message me later.
Miss Sally, are there going to be any frostbite questions? Because I saw on one of the assignments it had like frostbite on there.
No. Frostbite.
Okay. That's okay.
Well, I don't think you'll really see frostbite in clinical. We're not in an area that has a lot of frostbite, so no, we won't touch on that.
Thank you.
Mm-hmm.
So
Any other questions?
do we need to know all of the disorders too, like the skin disorders, like the different kinds?
I would stick with the ones that I listed. Do you want me to go through that list again?
Yeah, please.
I don't mind.
I'll take
Yeah.
yeah.
You got it. Okay. Let me pull up the list one more time. Pressure ulcer staging. Let's see. Herpes simplex, herpes zoster, rosacea.
Justin, I have a picture. Do you want me to text it to you?
No, it's just I got in a little late. I don't think I heard the beginning part of this list.
Oh, that's okay. Yeah.
I want to hear it too, please.
You got it. So herpes simplex, herpes zoster, rosacea, impetigo, cellulitis. There's one question on cellulitis. Psoriasis. What else is down there? Lupus and eczema. Oh, another one. Another one is scabies. So that's scabies. I love scabies. A little bit of question on scabies. Basal cell carcinoma versus squamous cell versus malignant melanoma. And burns, the different staging of burns, how to calculate the body surface area of burns. When it comes to burns, we don't just give them normal saline. There's a specific type of IV solution that's recommended for burns, and it's in your book, in the ATI book. Does anybody know? Want to tell me?
Does it have an L in it?
Is it what?
It's on the tip of my tongue. I don't remember it right now.
Starts with an L.
Yeah. LS or something ringer or something?
Mm-hmm. Lactated ringer. Yep.
Okay, I was in the ballpark. But yeah, that one.
Yeah. So what happens is lactated ringers is similar to our circulating, I guess you would say, extracellular fluid. So what happens in burns is fluid tends to go inside the cells, and we want to pull it out so that we maintain blood flow. So that's why lactated ringers will pull the fluid out of the cells so that they don't go into shock. Because in burns, they lose a lot of fluid. Yep. Okay. So I think we're good for med-surg. And then I have, I don't know if you guys saw all my announcements, but I'm going to do another session Sunday morning at 7, and then another session Sunday at 5. So if you need to attend again or have any other questions or just want to make sure your notes are complete from these, and yep, you can go ahead and join those too. Okay. All right. And then, huh?
Thank you for that.
Oh, yes. And I'm working Skills Lab on Sunday, so 10 hours of ACC for you guys.
You're my hero.
Anything for you guys. What are we doing? We're doing farm. Okay, so prepping and giving meds. I mean, you guys totally killed it on the quiz. I think you guys got it, even after fundamentals. So just to stick to your, core concepts. Equipment selection, sites for injections and all that stuff, techniques on how to give a baby oral meds, how do you do a sublingual, what are some patient teaching, like, if they say that their throat is dry, or their mouth is dry, can they drink water before, can they drink water after sublingual, so on and so forth. I think you guys got it for that. Topical medications, it's going to be the same concepts that were on the quiz. So, technique, how do we prep the skin? How do you administer rectal preparation? How do you teach a patient or how do you tell a patient to use an inhaler? How do we administer eye drop and eye ointment? Okay, anti-infective. All right, here we go. So anti-infectives will probably be the majority of the exams because it's newer stuff. So I have the PowerPoint pulled up. If you guys want to pull that up and kind of scroll through it and maybe add some notes to those slides, I'll give you guys a minute to pull it up. Okay, let me pull up my notes. One second. Okay, so on the slide, if you go down to penicillin, patient teaching for side effects, and interaction, medication interactions. Okay. For the next slide, the cephalosporins, you should know the name, be familiar with the name. What patients do we not give cephalosporins to?
People allergic to penicillin?
You got it. Yep. Interaction. So the disulfiram reaction. Okay. For vancomycin, you should for vancomycin, you should know the side effects and adverse effects that are listed there. The tetracycline, you should be familiar with the name, so it ends in cycline. Side effects, including that photosensitivity, so what would be some patient teaching to avoid or minimize side effects? What are some patient teaching for adverse effects? Like, oh, if you experience any of the following, this is when you need to come back. You should know the contraindications. So remember, we avoid all of these antimicrobials for which patients? For those that are breastfeeding, right? Because it can transfer to the baby. For the next slide, macrolides. Who do we give macrolides to? We give them if they have a penicillin allergy, right? Patient population is usually the preferred one. And then interactions and side effects, like patient teaching. How would you minimize the side effect? Next slide, aminoglycosides. What's the most common drug? Gentamicin, right? So you should be familiar that it's gentamicin. And what's different about this one? What do we usually do before we administer this one? anybody want to?
Do you create a culture first to know what kind of bacteria?
Yeah. This one is very, it's a narrow spectrum, so we really need, and it can have a lot of adverse effects, right? The nephrotoxicity, autotoxicity. So we really need to make sure that this is the correct antibiotic before prescribing it. And what organs do we monitor while we give this medicine?
Liver and kidney.
Kidneys?
Mm-hmm. Yep. Okay. Sulfonamides. Who do we not give sulfonamides to? People with allergy to
Sulfa?
thiazide diuretics or sulfonylureas, which is a type 2 diabetic medication, right? Super common. And then patient teachings for adverse effects. The fluoroquinolones, you should know the name of them. So these are drugs that end in fluoxetine and the contraindication.
I'm sorry, Miss Villanueva. Where is the PowerPoint for farm that you're referring to right now for penicillin?
It should be under, let me tell you exactly. So if you go to the farm under module,
Okay.
and then there's like the section that says, it says under lecture resources, week 4 anti-infectives PowerPoint.
I have it. Thank you.
You got it. Okay, cool. And then for tuberculosis drugs, basically those 2 slides. So, who's at risk of developing tuberculosis? What organ do TB drugs affect? You guys can answer that one. Which organ?
Lungs?
The medication, I'm sorry. Which organ do the medications affect that we need to monitor?
The liver.
The liver. They're all toxic to the liver. And then that last slide with the INH, rifampin, pyrazinamide, and the ethambutol, know the side effects and adverse effects, those 2 bullets that are on there. That's it. All right. Any questions on farm?
I have one more. I'm sorry. You said know the side effects and adverse effects for the last 3 meds that you named. Which were they?
All the meds on that last slide. The 4 TB drugs, the INH, rifampin, pyrazinamide, and ethambutol.
Got it. Thank you.
Mm-hmm. If you don't have any questions, you can log off. You guys have a great evening. But if you have any questions, let me know.
Alright, so are we gonna go over the same thing on Sunday, or is that gonna be new
Yes,
stuff?
same thing. Same thing.
Okay.
Mm-hmm.
Alright.
Thank you.
Thank you.
All right, I'll stay on until everybody logs off in case there's any questions.
Thank you.